in medical school and residency, just treat all fevers, low-grade fevers, treat them with acetaminophen. When my wife was pregnant and delivered our son a few months ago, they pushed her to take acetaminophen for a low-grade fever. She said no, and then they looked to me and I said, absolutely no. But to quote the dean of the Harvard School of Public Health, there is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We cannot wait any longer.
The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. HHS wants, therefore, to encourage clinicians to exercise their best judgment in the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required.
See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. Deal a doctor's decision, because I think you shouldn't take it, and you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire, and you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. Don't take Tylenol. There's no downside. Don't take it. Be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol, and don't give it to the baby after the baby is born.
So after all of that hoopla and people implying or outright saying causes neurodevelopmental disorders, here's what the actual letter from the FDA to doctors said. In recent years, evidence has accumulated suggesting that the use of acetaminophen by pregnant women may be associated with an increased risk of neurological conditions such as autism and ADHD in children. To be clear, while an association between acetaminophen and autism has been described in many studies, a causal relationship has not been established, and there are contrary studies in the scientific literature. In the spirit of patient safety and prudent medicine, clinicians should consider minimizing the use of acetaminophen during pregnancy for routine low-grade fevers. This is literally what the American College of OB-GYNs and the Society for Maternal Fetal Medicine advise. So they basically get to stand up there and fearmonger and exaggerate, which will result in many women choosing not to take Tylenol even if they are suffering, all while not actually doing anything at all that's not already being done. But then they can say, look at all this work we did to help this autism epidemic. It's absurd.